treating tuberculosis. That way diagnosis does not matter in homeopathy. Any diagnosis, if the patient has the symptoms, we can treat. But then as a beginner or as a practitioner, we had our own mindset which prevents us from treating tuberculosis. One of them being that, what if my remedy is not right? Then this disease will spread, etc., etc. Like during my time when we were asking our teachers, can we treat this case of tuberculosis? My teacher would say, no, let us refer it to Cooper Hospital. That is just bang opposite our hospital. There is this Cooper Hospital, and then people would be referred there. So basically we did not have the confidence. At the same time, while teaching Organon, we had this history of homeopathy. One of the pioneers, Boningoshen, Carl von Boningoshen, was supposed to be dying of tuberculosis, and when he wrote to his friend Dr. Wehe that I will not survive, I have this tuberculosis, so this is like a goodbye letter. Dr. Wehe asked him his symptoms and then prescribed him pulsatilla, and with that medicine Dr. Boningoshen got cured. We got a very good pioneer for our homeopathy, who was not a doctor to begin with, but who started practicing. And Boningoshen's contribution, it will take one more lecture, so we will not go into that. So the history says that tuberculosis was cured in 1828 with homeopathy. That was only 30 years into homeopathy when it began. And when I was a student in 1981-85, between 1981 to 85, that was nearly 150 years hence, people were not ready to treat tuberculosis with homeopathy. Ditto for malaria, for that matter. One of the senior person would say that malaria cannot be treated with homeopathy, and one of the allopathic doctor would say, you told me that because of malaria-like fever your homeopathy got discovered, China. So this dichotomy, when it is there in our mind, we always get confused. So how did I get the experience? So let me tell you a little history, little story, what happened. When I was the house physician or registrar rather, in the homeopathic hospital, one patient was referred by Bombay Hospital. 18-year-old girl from Mulund was under Dr. Bhagwati and Dr. Singhal, who are the neurophysician and neurosurgeon in Bombay Hospital. They are one of the senior most, and the patient was brought from there to Dr. Bhatia's, under Dr. Bhatia's care, and we admitted the patient. The patient was admitted in Bombay Hospital for nearly 9 months. The patient had tuberculoma. Because of raised intracranial tension, she would vomit out, and most of the medication except streptomycin was oral drugs, anticox. So whenever she would be taking it, she would be vomiting it out. Now the patient would deteriorate for 9 months. Keeping in Bombay Hospital even then was very costly affair, meaning they had to sell one of their flats in Mulund for that purpose, and they said, now we can't do anything. And to top it, they had got some injectable anticox medicine from UK, which also the patient could not accept it, and therefore they had nearly given up, and they brought to the hospital. Dr. Bhatia saw the patient in the OPD and said, let us give iodoform. Iodoform is the remedy, iodoform. And we asked him why iodoform, and when we see he said, open boric materia medica, and we found it is good remedy for tubercular meningitis. There is blurring of vision, there is difficulty in walking, so many symptoms. Whatever symptoms it told was there in boric in italics. Italics, it was very clearly given, and after prescription, third day the patient was off IV. The patient started eating what she was vomiting daily. The third day patient was off IV, and then sir said, now let us give 1 dose of tuberculinum to her, and then the patient improved. She became all right. Now the problem was, those days the CT scan had just come into the market. MRI had not yet come, CT scan, and it was a very costly affair. So the CT scan was showing tuberculoma. So after 3 months when we got the CT scan, there was a reduction in the size. Dr. Singhal himself came down from Bombay Hospital to see the patient here and appreciated that yes, homeopathy did cure. This was first case. Again, the problem was that tuberculoma is not transmittable, but pulmonary cox is. and still we did not get the confidence. And what case we got at that time was of rebound. Now I had this evening OPD, and in the evening OPD, we had evening OPD in the hospital between 6 and 8. So there is one patient, I remember his name because I consider him my guru to teach homeopathy in tuberculosis. So he comes, his name was Baburam Tiwari. And this gentleman comes and says, ki, Dr. Saab, hame dekho. He had come with a jhola, comes to the OPD. I took the case and I said, your diagnosis, तुमको TB है. He said, yes, तो क्या करूँ? आप Cooper में जाइए and you take the allopathic medication. Now listen carefully what the patient interacts with me. The patient, first question the patient asks, TB के लिए homeopathy में दवा नहीं है? So I said, yes, we have medicine. So देते क्यों नहीं? Why are you not giving? So I said, I am not giving because I am anxious that this remedy may not be right, so it might spread and you will infect others. No, all whatever was taught to my by teachers, I told him verbatim. He said, क्या सभी बीमारी, सभी TB के मरीज एलोपैथी से ठीक होते हैं? See each question so beautiful. That's why I call him my guru. सभी patient ठीक होते हैं? I said no. ऐसे भी होता है कि कभी कभी ड्रग रेजिस्टेंट होता है. तो उन्हें कैसे पता चलता है कि ठीक हो रहा है या नहीं हो रहा है? देखिए ऐसा है कि हम लोग CBC करते हैं, ESR करते हैं, खून का तपास करते हैं और एक्सरे निकालते हैं. तो आप आपकी दवा देके क्यों नहीं कर सकते? What more do you want? It's like he takes you into the corner and tell me, give me homeopathic medicine. No other option, but give me the homeopathic medicine. I said fine. Once he has pushed me into that corner, I had to give him. He had pleural effusion. He had lost weight, and after that his ESR was around 45, coughing, evening rise of temperature. After the symptoms, we gave him Kalikab 200, 1 dose, because we were afraid of so many reasons what was there in the books, which I will tell you afterwards. The patient's temperature disappeared. The next day onwards he never got temperature. His weight increased by 5 kgs in 1 month, and after the X-ray when we done, the X-ray was showing no effusion, pleural effusion. When I showed it to Dr. Khanna, who is our physician out there, he said, according to me this is cured within the period of 1 month. So that was my first case of tuberculosis, which was treated only with homeopathy. To top it all, the patient, his jola had a significance. When I told him, ye homeopathic dawa le lo, then he took out 10 bottle of ambistrin. Ambistrin is streptomycin. Those days it was coming as ambistrin, 0.75 grams. He would put on the table. मैंने दवा खरीदी है, लेकिन मुझे एलोपैथी लेनी नहीं है. I mean, there is no other option but to be thankful, and I dedicate my lecture to this patient and teacher of mine, Baburam Tiwari. Let's go further. I will talk about the general problems which we face in tuberculosis. Before that, one case. This 23-year-old Muslim man has come with weakness since 5 months on 18/8/2008. He had history of cough, low grade fever, anorexia, 2 kg weight loss in the month of April 2008. He went and got the X-ray done. X-ray chest was done, which was suggestive of Cox right upper and mid zone. His CBC done on that day was showing ESR 21. All other things are normal. Lymphocyte is 33, not much high. X-ray when he came to us, 4 days before when he came to us, you can see that right upper zone Cox there. Infiltration, you can see that. So that was there. Patient was not gaining weight. He also complained of frontal headache, dull ache, intermittent pain, aggravated by exertion and ameliorated by rest. Past history, in 1996 he had taken 1.5 year anti-Cox line of treatment. His father had a history of cough. In physical generals, he liked fish 3 marked, eggs, curd, butter, milk, fried food and spicy food. He had profuse sweat on the chest. He was a chilly patient. Now this is the mental history which we had taken. He had a lot of tension since last 5 years. He used to like a girl. He wanted to marry